So many people thought I was crazy when I shared my plans to birth unmedicated using hypnosis, but I believed I could and I succeeded. I'm a first-time mom to my beautiful 7-week-old baby girl. My name is Kim and I'm a miraculous mama.
Hey everybody, welcome back to Miraculous Mamas. I'm your host, Elizabeth Joy, and I am so glad that you are here. We are a podcast that believes in empowering women through storytelling and education. I have an amazing guest for you guys today. I have Dr. Jolene Brighten on, and she is going to talk to us about PCOS. You guys have asked to have an episode on PCOS. I heard your request. I wanted to bring the right person on. And she's also going to touch on a few other things. She's amazing when it comes to women's health. She's been in the industry for a very long time. And we have a great conversation on just women's health and how it's so hard when you're dealing with these issues like PCOS. You know, she talks about how it takes the average woman 2 years and 3 providers to get diagnosed. This should not be happening. And there's so much we can do to push for change and to prevent women from continuing suffering when it comes to endometriosis, PCOS, and other hormonal issues that we have to deal with. You know, that if men were the ones with PCOS, it would be diagnosed right away. It just really would. So we have to continue to push for change and expect more from our healthcare providers and push for more education when it comes to those types of things. So I'm super excited that she is here. But before we get into it, January is National Slavery and Human Trafficking Prevention Month. So I just wanted to take a minute to talk about that. Human trafficking, it's a crime, and which they use force, fraud, or coercion and use to compel a person to perform labor, services, or commercial sex. It affects all populations: adults, children, men, women, foreign people, U.S. citizens, and all economic classes. And the Department of Defense continues to raise awareness and to do its part to end this crime. If you suspect human trafficking, please contact the Department of Defense Inspector General Hotline. It's 1-800-424-9098. There's also the National Human Trafficking Hotline. It's 1-888-373-7888. Also, there's different things that you can do to get involved to help continue this education and preventing this from happening. You can attend an event. There's a lot of events if you look into your local area. January is definitely full of them, but they have them in big cities, but also in your smaller ones like Duluth, Minnesota. They're doing their part to prevent modern day slavery by showing documentaries and hosting discussions about it. You can also give a little. There's organizations like Compassion First that will match every dollar donated to stop human trafficking for the month of January. And all the proceeds from the Patreon we're donating to Compassion First this month because it's such a topic that is close to my heart. It's such a sad thing. I don't understand why these types of things are still happening. I don't understand how people could be so cruel. And I would love for you guys just to join me by getting involved. If you go to the humantraffickingsearch.org, you can find organizations by state to see and like what you can do to help and how you can get involved. You can just read up. There's the New York Anti-Trafficking Network. It's publishing a series of blogs discussing different human trafficking issues. You can also read Women at Risk International. They have a great month-long calendar filled with daily informational facts and activities on human trafficking and organizations working to stop it. So that's what you can do. Also, if you want to do more, take some time and flag Craigslist.org posts that advertise or seemingly promote sexual services provided by underage young girls. It's crazy. If you go to Craigslist, you can see advertisements for this stuff. And if you have time, go through and read them and flag them, report them, do what we can to get these things stopped and under control. Also, I was reading a crazy statistic the other day. If your child has a cell phone, monitor the apps that they're on. If you have a kid that is on social media, then they have already been looked at by a predator. There's millions of people who are predators, and their job is to be online all day long looking for people. So just take that into consideration. Your kids, it's I know you do what you can to protect them and love on them. And maybe they think, oh, I'm going to die without having social media. And it's like, no, I'm doing what I can to protect you because the risks out there are absolutely crazy. I remember reading a story just this month about an 11-year-old girl who got abducted getting off of the bus. And because they put an Amber Alert out and the car that took her, they were able to actually get the guy and rescue the girl back. And we need more success stories like that. We need more people pulling together, turning people in, reporting suspicious behavior, whatever it is, to help stop modern day slavery, human trafficking, sex trafficking. It needs to end now. So my rant is over, but it's something that I'm super passionate about, and January is the awareness month for it. So do what you can to be a part of it. If you know people who this has happened to, share their stories, because it does happen right under our nose in our own communities. And so just do what you can to get involved, be aware, protect yourselves, protect your families. Look out for each other's families. If you see somebody suspicious that's looking at somebody else's family or whatever it is, it's time to pull together and have each other's back and look out for one another. So I'm going to take a quick break from this episode to talk to you guys about one of our favorite sponsors. Now that we're all settling back into our routines and your little ones are off to school, it's time to freshen up those lunch boxes. And that's where Perfect Kids snack bars come in. From the makers of Perfect Bar, the original refrigerated protein bar, Perfect Kids is a line of fresh from the fridge snack bars made from organic peanut butter. They have up to 8 grams of whole food protein, 8 organic superfoods handpicked for kids' nutritional needs, and a cookie dough-like texture that both you and your kids will love. Perfect Kids bars are kept refrigerated, but don't worry, they're good for up to 1 week out of the fridge. As we all know, nothing spoils carpool faster than a meltdown from your little ones. So be prepared with nutritious and delicious snacks to keep everyone full and in good spirits. They are amazing snacks that you can feel good about giving your children because Perfect Kids bars are organic, non-GMO, project verified, gluten-free, soy-free, kosher, and a low GI. I gave some to my nephews the other day, and they actually think that they're dessert. That's right. They were like, oh, we're ready for dessert now. And what they're getting for dessert is protein, whole foods, good things that are for them. So it's super exciting to have that healthy option to be able to give your kids. And if you're looking for a snack to help you survive parenthood, for me, it's babysitting. Whenever I watch them, I'm like, here, have one of these. Then their full-size protein bar is for you as well. I love their full-size protein bars. My favorite is the original peanut butter one. It is so good. I also they have a chocolate chip one that is delicious, and they're good for me on the go because I also know that if I don't have a good snack on the go, I also have a meltdown. So I know everybody's busy, but it really is the perfect snack for you and your kids, your entire family. And right now, Perfect Bar is offering you 15% off your online order. Just go to perfectbar.com/mamas15. Shop their refrigerated snacks at perfectbar.com/mamas15 today to get 15% off your order. Be ready this season with Perfect Kids. Go to perfectbar.com/mamas15 to stock up and save 15%. Now back to the episode. All right, without further ado, I'm going to get Dr. Jolene Brighten on. Get ready to learn a lot and have a great episode with me. I have Dr. Jolene Brighten here. She is somebody that I heard of actually through the Fertility Friday podcast, and I had Lisa Hendrickson-Jack on the podcast, and then I started listening to it, and I heard you on her episode, and I was like, oh my gosh, I have to get this woman on Miraculous Mamas. And so Dr. Jolene Brighten, she works with people's hormones. She helps people understand symptoms and get to the root of the problems, treating the body as a whole, healing yourself from the inside out, and the work that she's doing is amazing. So thank you so much for agreeing to come on.
Thanks so much for having me. I'm really excited for this conversation. Not everyone can see your face. I can see your face. And you guys, she's like glowing, smiling. You have such a big grin that I already know this is going to be really good.
Yeah, I'm so excited. So I would love for you just to kind of tell us in your own words the work that you are doing.
Yeah, so I am a nutritional biochemist and a naturopathic physician with an emphasis in women's health. So I work with a lot of ladies who have a history with hormonal birth control, currently using it, or are struggling with post-birth control syndrome. And that is those lasting side effects of hormonal birth control that when we try to break up with it can be a little bit tricky. And so, I have my own private practice. I work with patients one-on-one, but I'm also an educator, and that's how I see myself. And really, I'm on a mission to help change women's medicine for the better. And I very much believe that that's not going to change because of me or because of any other doctor saying we need to change this. It's going to change when we educate women, when we remind them of their power, that they've always had the ability to heal, and that they can go into their doctor's office having much more productive conversations and be able to advocate for themselves on a new level so that they can get the care that they need and not just be past a elective surgery or elective medication as a way to basically deal with their symptoms. I very much contend, and this was a bit of my wake up while I was in medical school, is that you shouldn't have to go to medical school to understand the body you live in, to understand how your menstrual cycle works, to understand how to leverage your hormones as superpowers rather than letting them own you and feeding into that old story that our hormones are just what make life inherently awful for women. So that's a lot of what I do. So I'm an international speaker. I'm all over social media. Thank goodness for social media, because it is such an easy way to impact millions of people who wouldn't be able to meet with me one-on-one in my office.
Mm-hmm. Yeah. I mean, just by following your account, I've learned so much because you always put up like little tips, and I actually screenshotted a few that I want to talk about. But speaking of, going to the doctor and needing to advocate for yourself, I was reading up on PCOS, which we're going to talk about. And it says that it takes up to 2 years and going to 3 different health professionals to even diagnose that you have it. I mean, talk about advocating for yourself.
Totally. Well, and what's the root of this is really not that your doctor is a bad person. So that tends to be reflexive, where people are like, we want to blame someone. We want to say it's someone's fault. If it's anyone's fault, it is the scientific community's fault and medicine as a whole. We're not including women in more studies. So the reality is that there's a lot of drugs on the market that are prescribed to women that we actually don't know. We've never done a study that we don't know what they do to women. And then when we look at hormonal birth control, I mean, that's a pharmaceutical that is so ubiquitous. And like, as a first generation college student, super, super grateful I could get my hands on that. Banish my bad periods. Of course, I wish someone would have told me what was up with my periods. But, I banished my bad periods for 10 years. I was able to accumulate multiple degrees in college as a first generation college student. So super grateful to have it. Yet at the same time, as I was writing Beyond the Pill and getting more and more to the research and understanding that there's so much we don't know because we've refused to ask the question.
Yeah.
Because questioning hormonal birth control's impact on women's bodies became too taboo. And there are people who actually say that's anti-woman. And like, anti-woman is not giving her the informed consent, not doing our due diligence. And why I bring up hormonal birth control in this is because this is often what happens to women with polycystic ovarian syndrome or PCOS. So for women who don't know what this condition is, really the hallmark of the condition is irregular periods because you have an ovulatory cycle. So you're not ovulating. The brain ovarian communication is off. And in addition to that, the metabolic component is really driving that chariot. So let me explain that. Polycystic ovarian syndrome, at the root cause, is it's a metabolic disorder with inflammatory components, likely linked into gut health as well, like everything. Mm-hmm. And yet it manifests with hormonal symptoms. So the irregular periods, hair growth, chin, chest, abdomen, losing hair on our head, cystic acne, maybe just on our face, but maybe also on our back, on our chest, other places as well. And for some women, there's weight gain because of insulin resistance and the metabolic component. Not every woman with PCOS will gain weight. And please understand that not every woman will actually present in the same way. So when it comes to syndromes, so polycystic ovarian syndrome, post-birth control syndrome, irritable bowel syndrome, these are collections of signs and symptoms that go together, but they don't necessarily mean that one person will have every hallmark of that condition. And with PCOS, old school docs have gotten it in their mind, and it's kind of stuck there because of like when they were trained, that if you have a PCOS woman, she's going to be overweight. Like, and if she's not overweight, it can't be PCOS. And then, other times they're like, oh, will you sometimes get your period? Well, that can't be PCOS because you'd never get your period. And that's a bit rooted in the fact that most doctors do not have substantial nutrition education. So, I'm kind of unique in being a nutritional biochemist before going to medical school. And for people who are like, what is that? We study nutrition science and we look at how nutrients can impact disease, preventing disease, making disease come on for sure, but also used in the treatment of disease as well. And I've seen a lot of women with PCOS actually be able to control their symptoms with diet and lifestyle management, and then they don't get that diagnosis. Now, the piece of the pill coming in is with hormonal birth control, we understand now that more than half of women using it are using it primarily for symptom management. Yes, we still want to prevent babies, but it's usually for things like acne, irregular periods, painful periods. And we're told this will fix your period. When in reality, not a medication that shuts down your entire reproductive system cannot and will not fix your hormone. It's making your ovaries stop. That's its job. And so women with PCOS, part of this delay in the diagnosis from what I've seen clinically is that they're past hormonal birth control. So they start their period maybe at 14. By 15, it's sporadic. And they're like, maybe I've gotten it twice. Their doctor says there's a pill for that. I can fix that. Just take that and go on your merry way. And then it's when they're like, well, they enter, maybe they're sexually active at the time or they become sexually active. Great, got this birth control method. Then they get into their 30s and they're like, well, I want to have a baby, except that you've actually had this metabolic disorder that leads to infertility brewing unaccounted for because your doctor just checks in. Are you bleeding? Yes, great. You're getting your period regularly. Well, we need to correct that language. The only one people having periods are people who are cycling hormones and who are ovulating. We are not having periods while we're on hormonal birth control. We're having medication-induced withdrawal bleeds. And this is one of the many areas of women's health that we have to refine the language and how we talk about this because it's inaccurate what we're saying.
I feel like my mind is just exploding right now because, so I got my period right when I was about to turn 14. And I remember it was so light, just barely spotting. And then the next couple cycles, it was so heavy. And I got put on birth control at 14. And I only took it for a couple years. And I'm in my early 30s now, so I haven't been on it in forever. But but also like at that age, I didn't understand a heavy period. So it was heavy for me. And I was only wearing pads and it was hard to deal with. And so
pads are so hard to deal with. I just want to say, like, as soon as you say that, I kind of cringe because I had just so many pad fails.
Right.
So many bad. I'm like, those were really cute overalls. Cause yes, I'm old like that. We were rocking overalls in the 90s and they were destroyed. But right there, I think you hit the nail on the head on a really important point. And what chapter 4 of my book is dedicated to is helping you understand what's normal and what's not normal. Because I don't know about you, but I never got told what was normal until I was going into clinical nutrition. And it was like, okay, we look for abnormalities because if there's abnormalities, then we need to come in with like iron-rich foods and B12 and B6 and folate, all these things that build blood supply because we're losing a lot of blood. And then into medical school to understand like not everybody has a 28-day cycle and that young menstruators actually do not start off with regular clockwork periods a lot of times because I call it a dance. And it's like for anybody who has ever tried to learn dancing, you understand you're going to trip. There's going to be some hiccups. It takes some time to learn the routine. And your brain and your ovarian communication, the ovarian, the hypothalamic pituitary ovarian axis, that's how the brain is communicating to the ovaries, that takes time to mature. And in fact, Dr. Jolene Brighten's work has shown us that it can take 10 years, a decade, for that system to mature, which is part of the issue. I hypothesize that when we come in with hormonal birth control, what we're seeing from the research that's finally getting done is our adolescents are at the greatest risk for depression, anxiety, suicide risk. And there was a study that just came out in 2019 showing that if you ever started hormonal birth control as a teenager, you are forever at risk, increased risk of depression and mood symptoms. So that's me. That's you. Does that mean we're stupid or we should hate ourselves or we should hate our doctor because we did this thing? No, but it is important to know this and not to get afraid. But if you're aware of this, then you can make changes. So if I'm aware that I am going to be forever predisposed towards developing depression, then you better believe I need to exercise. I need to be eating foods that nourish my brain. You know, I had a traumatic brain injury in 2016. That puts you at higher risk for depression and mood symptoms. So me knowing that, me knowing now and knowing that my history, okay, so I need to actively tend to this and also let my inner circle, my social circle know that if I start acting, strange and being withdrawn and talking slow and unmotivated and basically opposite of what I am right now, that we need to check in because reality is with mental health, it's so stigmatized. So nobody really wants to talk about it. But also when you're in the thick of it, you're in the thick of it. So you don't know to ask for help. And this is one way that if we know the impact of birth control, that we can take action and take steps to safeguard our health and make sure that our community has our back.
Yeah, no, that's really great information. And I mean, it is good to know. I've read a lot lately on brain injuries and how that can affect your health later on. And which is why my sons will never be allowed to play football. But
oh, no. Cut it down. My son, he was a chunk little baby.
Oh, I love it.
I loved it too. We used to call his thighs turkey's thighs, and they were just huge. I mean, he breastfed a lot, so I'll say there's that. But and I would wear him. I wore him for years, and people always in the grocery would come up and be like, "He's gonna be a linebacker," and I'm like, "No." Mama took so much fish oil during her pregnancy. You don't even know what I did to grow this brain. I grew this brain. No, shut it down. And that was before all of these football players were coming out and really being very vocal about it. But I mean, it's also something too of looking at soccer. I have had a lot of patients with head injuries, and we usually think oh, you got to get knocked out. You got to have a concussion. But actually, the repetitive trauma is almost worse. And so I'm not dissing soccer, especially after in 2019, us winning and love it. And I think sports are great, but I do think we need to be critical about that. I appreciate you bringing that up. Not a lot of people talk about that or will say that. And I'm no, my son can be a swimmer.
Right.
He can be a swimmer. No high impact to the head.
Right. Yeah, no. My husband's actually the first one who was like, yeah, no, our sons aren't doing that. And then after reading a lot on it, it is good information to have and to know.
Yeah.
So going back to PCOS, so you said you can kind of change some of it with diet. What are the risks if this goes undiagnosed or if you are you had mentioned infertility before?
Yeah, totally. So if you're not ovulating regularly, getting pregnant is going to be trouble. It's going to be a little more difficult. There are certainly women with polycystic ovarian syndrome who are able to have healthy pregnancies. I've helped a lot of women with PCOS get pregnant, but it may take a little more effort than the average woman just because of those anovulatory cycles. But I've also been able to help women restore their cycles and ovulate regularly, to which the thing that always cracks me up is that their doctor will say, well, you must not have had PCOS then. If you were able to correct it with diet and lifestyle, it must not have been PCOS. And it's we had the insulin resistance. We had the inflammation there. We had the elevated androgens. So all of that showing up in the blood work. I just want to clear up a myth. So polycystic ovarian syndrome it does need to get renamed because it's an inaccurate way to describe it. Language and medicine, understand these places, they're just starting places for us. But we've had to do so much advocacy just to get science and medicine to wake up to PCOS. I don't think we can rename it now. But polycystic ovaries, those are not cysts. Those are your ovaries really trying to ovulate. They actually show follicles. And, classically PCOS was described that you would have this strand of pearls on your ovaries. Not everybody has that. The younger you are, the more likely you are to show that. The younger you are, the more likely you are to show what look like, I'm doing air quotes, guys, cysts on your ovaries. And yet the older you are, so if you're like 38 and you go to get the ultrasound and they don't see the cysts on your ovaries, that's not ruling out. That's not ruling out the condition. Really, we have to look at the whole picture, which is the metabolic picture, insulin resistance, inflammation, and looking at androgen. So looking at testosterone, free testosterone, absolute must in women. It's not enough just to look at total testosterone. We have to look at it through the lens of how old you are. So, because there's different changes through our life cycle with testosterone. We also want to look at DHEA, which is an adrenal hormone that has the potential to go into testosterone or go into estrogen. So with that, we see that polycystic ovarian syndrome, it does get missed or misdiagnosed quite a bit. And so it's important to know what the labs are. And then when you understand, so when you start to understand like, okay, this is an inflammatory condition, you can take steps to lower inflammation. One thing that people are always surprised about is when I ask my patients, how do you talk to yourself? Okay, so you're going to start this diet. Like we do nutritional interventions and we remove foods. We do elimination diets, not because any of these foods are bad, but because we have to know what's true for you, what's interacting in your body, what works for you, what doesn't work for you. And I'll ask, okay, so let's say we're taking out gluten and you mess up and you end up going to sushi and you get soy sauce. Like how would you respond? And if they're like, oh, I would be so angry with myself. Okay, that's going to increase inflammation. So the best thing you can do, actually talk pretty to yourself, talk nice. I think of David Sedaris every time I say this. He has a book. I'm a big fan of his. I love his books. But you need to talk nice to yourself. You need to be gentle with yourself. And you need to understand that screwing up is the human experience. It's what you're here for. It's what we learn from. And sometimes when people mess up on the diet like that, they're like, oh, snap. Gluten makes me feel awful. And I'm like, well, we tested it. Now we know. So that's a really big piece is bringing down inflammation, optimizing blood sugar, insulin sensitization. And as I say all of this, for anyone who's, familiar with how chronic disease develops, most chronic disease is rooted in inflammation and metabolic issues and gut dysfunction because the gut is where the immune system lives. So 70% of our immune system lives in our gut. So with that, if you are not managing your polycystic ovarian syndrome or you were put on hormonal birth control, so chapter 8 of my book, which is Reversing Metabolic Mayhem, goes all into this problem, which is hormonal birth control. So the pill specifically, it depletes nutrients, leads to nutrient deficiencies. It's inflammatory. So it's already inflammatory. And these contraceptives can actually increase your cholesterol. So like triglycerides and LDL, what gets called bad cholesterol. You have the wrong kind of cholesterol elevated, meets inflammation, and that's where we get plaques in our heart. And hormonal birth control can also lead to elevations in blood pressure. So does this mean that hormonal birth control, no one should ever use it? No, it means that you need to measure and you need to track these things, make sure you're staying safe on it. Because women with polycystic ovarian syndrome are at higher risk for diabetes, cardiovascular disease, and these are things that hormonal birth control itself can increase the risk for. So if you're going to use it, you need to make sure that your doctor got your blood pressure, it's being monitored, that you checked your cholesterol, and then you go back in and you check again in a year to make sure that everything's going okay. I typically will check CRP, a marker of inflammation, 6 months after starting birth control, because if that inflammation is going up, it's just a matter of time till we have cellular resistance to our hormones. That's just the way the body works. So, with PCOS, we talked a bit about fertility, and that's a concern if you want to have a baby. But, for me as a doctor, I get really concerned about your metabolic health and, what the potential is. I had a mentor very early on who said that when every patient walks into the room, your responsibility as a doctor is to ask yourself, what are they going to die of? What are they going to die of? And then your work is to try to prevent that. And so that sounds really morbid and scary, but that is the weight of being a physician, is that, if we're going to practice true preventative medicine, I need to be looking down the road in 20, 40, 60 years. What is that person's life going to look like? And what can we do right now? So like with osteoporosis, this is something that like, I'll be talking to 20 somethings about it. They're like, that's a 60 something year old's disease. I'm like, that started when you were a teenager. And I don't know about you, but I didn't have the best diet when I was a teenager. So let's do what we can now, because once you fracture a hip, your morbidity increases. Let's just not do that. Let's not go there.
Yeah. I'm going to take a minute to talk to you about one of our favorite and just trusted sponsors, and that is Native Deodorant. I've been using them for over 6 months now, and I could not be more pleased with this product because it can be really intimidating and kind of overwhelming making the switch to an aluminum-free deodorant, but it doesn't mean that you have to sacrifice on smelling bad at the end of the day and having pit stains through all of your clothes. And I am a sweaty human being, I'm not going to lie. And finding a product that worked for me was a struggle, but with Native, it literally worked from day one. I smelled good at the end of the day. Vito noticed a difference, so it has his stamp of approval on it. But the things that I love about Native is just their company, what they believe in. They're formulated without aluminum, parabens, and talc. They're filled with ingredients that are found in nature, such as coconut oil and shea butter, which helps moisturize, and tapioca starch, which absorbs your sweat. They don't test on animals, and they have free shipping and returns. Plus, they have over 9,000 five-star reviews. You can check them out on the Today Show and Elle Magazine, Pop Sugar, Refinery 29, just to name a few sites that also rave about this product. And it's also nice to have something where you know the ingredients. And that is another reason why I love them. And they have something for everyone. They have men's deodorant, they have toothpaste, they have other things. They have formulas for if you have sensitive skin, baking soda free formulas. And I'm going to tell you really quick about my favorite scent, which is citrus and herbal musk. But one thing that I love about them, so they have these travel size deodorants, but then they have even these like mini ones that are so cute. And a couple weeks ago, I got called into a birth, and I got called in to 2 births. So I had to go back-to-back births, and I always carried this deodorant in my bag and the little mini one. And it literally saved me because I went from one hospital room, I had a 10-minute break to shove a granola bar down my throat and then try to freshen up, because being a doula is physical work. I do get sweaty. I get worn out. I'm always sore at the end of the day. And I went, reapplied my deodorant, put on some chapstick, ate a granola bar, went to the bathroom, and headed to this other birth. And it saved me. I just love being able to carry it around. There's one that's small enough that I can keep in my purse if I need it. But they're such an amazing company, and that is why we have just continued to partner with them. And we have a great offer for you guys today. For 20% off your first purchase, visit nativedeodorant.com and use Miraculous during the checkout. That is 20% off your first purchase. Visit nativedeodorant.com and use Miraculous at checkout. I love that train of thought of, okay, as morbid as it may sound, what might this person die of, instead of, okay, what symptoms are we covering until it all just unfolds, later in life, because that's something I've seen a lot of, and it's something I'm super passionate about, because I don't know, it's just so hard, because the body has to be treated as a whole. And I loved, one of your things that you said was how, high estrogen is usually a sign of your gut and liver health. And I've been working with a holistic doctor for 6 months now, and we tested my hormones. My estrogen was out of control, and it's because my body couldn't eliminate it, because my liver was not functioning properly due to my gut being overinflamed and having a parasite, and all these things were connected. So I had to cut out, I did a hormone test, a food allergy test, a stool sample test, and it's like it's not just one thing. And going to my gynecologist, when I've presented symptoms before, the answer has always been birth control or a hormonal blocker. And I'm glad that I didn't do either of those, because I got to the root, and it's usually always comes back to your gut health or your...
I know, right?
Yeah, well, because
that's how I started out. I was, when I was getting my master's, and then I got accepted to naturopathic medical school, and I was like, well, Part of me is like, I wish I would have just finished my master's, but that was ego. That wasn't really about like, following your passion necessarily. So when I went off to school though, I was like, I'm going to focus on gut because I had a history of gut issues. I was offered, I figured out at an early age, if I shifted my diet, it changed everything for me. So, in that I was like, I'm going to study gut health until I had this moment of sitting in class and just realizing that like so much of my experience as a woman in medicine has been medicine doing it to me. And that so many women, we go to the doctor's office and medicine is done to us. There is no like, hey, I'm going to insert the speculum now. Is that okay? Like, it's more, okay, I'm inserting the speculum. Very procedural. Mind you, your doctor is like doing a lot of things in their brain and then doing this procedure. So like, this is what we call the bedside manner. But to just really recognize, like my mentors were doing it so differently in that they would ask permission every time. And then the informed consent was so different. It was, this like, here's, and this is what's different about naturopathic physicians is that we're actually trained in pharmacology because yes, guys, even though there's nature in our title, we do use pharmaceuticals. There's a time and a place for symptom management. There's a time and a place for pharmaceuticals, but we also study alongside that herb and nutrient interactions so that we are, arguably the most qualified to tell you about a drug nutrient interaction, a drug nutrient depletion, a drug herb interaction. So, in that, you're right. Just about everything starts in the gut and in Beyond the Pill. I get, once we get out of the like, let's solve all your period problems chapter, we go right into liver health. And the editors for the book were like, that's not very sexy. Of like, you're going to just start with liver and then go with gut. And I'm like, that's absolutely necessary. If your liver and your gut, you're going to like, people love to chase sex hormones and they're like, let's get the estrogen right. Let's get the testosterone right. Let's get progesterone up. You can't get your progesterone up if your adrenal glands are getting fired off to the signal that we're totally stressed out, or you can't optimize your estrogen if your liver can't package it up and your gut and your kidneys move it out of your body. Because so if people are, okay, let me not be such a nerd, and I want to bring everyone with us. Okay, so your liver packages up estrogen into harmful metabolites potentially and not so harmful metabolites, more beneficial. So we've got 2, 4, and 16 hydroxyestrone. So even if your estrogen levels seem normal in a blood test, if you don't have your metabolites tested, you don't really know the full picture of what's going on. And for example, you could have elevated 16 hydroxyestrone normal. Okay, so your estrogen's normal in your body, but you're processing it and you're putting it into this metabolite, actually leading to clotty periods, very heavy periods because of how it's stimulating the tissues. Your breasts are tender. So understanding that we want to get everything into the right pathways as best as we can. And we do this, the diet that I give you in Beyond the Pill. I always hate the word diet because I feel like it's like, this is not about weight loss. Although I will say that when you're eating in a way that really lowers inflammation and starts to optimize hormones, your weight will find where it's supposed to be. No, if you're really by design meant to be a size 8, you will not become a size 0.
Right.
It's just not your body type. But in that, we've got the diet, we've got the lifestyle pieces that get everything packaged up. Then it goes into your gut. And bile is really important. So your gallbladder is really important in this. When it goes into your gut, if you have overgrowth of the wrong kind of organisms, or like they're not pathogenic, they're not disease causing, they're just an overgrowth, what we call dysbiosis. Certainly having a parasite, you've got dysbiosis. The whole system's disrupted. Mm-hmm. Now, these organisms can increase an enzyme called beta-glucuronidase. So they're going to make this, and it is going to do everything that your liver did to package up estrogen and get it out of your body. That beta-glucuronidase is going to undo it. And it's called reconjugation. Now we've reactivated estrogen, but here's the kicker. It is not bound to a protein. So now it gets to go play. And I like to call, estrogen, like all the hormones are divas, and the estrogen is really like the Beyonce. Because the reality is if you put Beyonce on stage, it's going to be really hard to have anyone show her up. Like everyone's going to be like all eyes on Beyonce. And that's kind of estrogen. And once estrogen gets out and gets onto those receptors, like she calls the shots. And so even if you have adequate progesterone production from your ovaries, you can still find yourself with symptoms of estrogen dominance. And that is a frank estrogen dominance. Now, we have way too much estrogen in the system. That can be because you make too much of it, because you're not eliminating it effectively, or xenoestrogens can come into play as well. Those are not estrogens. They're not what you make. They don't have the same benefits. They just have all the same troublemaking properties.
Yeah. Well, I'm glad that you explained that, because I'd love to get into a little bit of PMS, because you said if you're estrogen dominant, you can have clotty periods, you can have all these things, which is something that I've kind of always had. I have super regular cycles to the day, and I can always tell when I ovulate. I'm one of those people that checks my cervical mucus, and I can tell. I don't know. I try to be super in tune with my body, but I've always had pretty heavy periods, and my boobs hurt, I'll clot, and again, that was a symptom that I went for the doctor for. One time I had a horrible period. I was clotting tons, and the answer was birth control. And I'm like, I just can't, because although I was on it very early in my life, I tried it once in my 20s for like a couple of weeks, and I was on the lowest dosage, and I felt like a psycho person. And I'm like, I can't take this. Even my boss was like, Liz, what's going on? Are you okay? And I just started bawling. I'm like, I started this new birth control. I don't have any control over how I feel. Like, I was not myself, and I had to get off.
That's the worst too, right? Mm-hmm. That's the worst, when you're like, I know what's going on here, and I have zero control. Because that's the other thing. So one, society's like, don't let your emotions show, because we'll use it against you, you overly sensitive woman. Hate to break it to y'all, emotions are a normal human experience, and men's hormones influence theirs as well. But the other piece is feeling out of control and not being able to talk about it. I do want to flesh something out there because this has been coming up a lot lately. And I'm like, I really need to explain this. So PMS, premenstrual syndrome, what gets diagnosed, this is the diagnosis, premenstrual tension syndrome. This is before your period. And so this is really important for women to flesh out, because often women are like, I have PMS, and then they talk about their period. So this is leading up to your period. And this is really important information to flesh out, because that can actually tell you, I know what's going on PMS wise, and I know what's going to happen when my period comes. So if I've been essentially disobeying the laws of nature and not sleeping and not moving my body and not eating well, then I know I'm going to I'll have PMS. I'll be really, really irritable. And when my period comes, sure enough, it ain't fun. But when you know that, so for example, if I know, I actually share with my audience when my dog passed away abruptly. I'm an animal person. So it wrecked me. And I knew I was just around ovulation, and I was like, this is going to be a terrible period. And sure enough, my PMS was ramping up. But because I knew, I was like, I'm going to get my magnesium up. I'm going to increase magnesium. I'm going to increase. So I increased to 600 milligrams instead of 300 milligrams daily. I doubled up on my fish oil. So my Omega Plus, I usually take 2. I took 4. Why? It's going to help with prostaglandins. It's also going to help with inflammation. It's going to help with processing that estrogen. Prostaglandins are hormone-like little chemicals that cause those contractions in your uterus. A very, very good thing when you want to shed the uterine lining or you want to get a baby out. But not such a good thing when they're super, super potent, which they can be if your diet is really rich in omega-6 or you're low in omega-3s, vitamin E, magnesium. And then that's when we get period diarrhea. So if you're someone who's with my patients, they'll be like, I have really bad cramps. I'm like, do you also poop a lot on your period? They're like, how did you know? I'm like, prostaglandin. And that's a question right there that will dial you in. But does that help in terms of flushing that out? This is PMS, that's before your period, and then you have period symptoms.
Well, I know for me, the PMS is my boobs will start hurting a week before and be super, super tender. And then I usually get a hormonal migraine. But since doing I started seeing a chiropractor again, which I hadn't in a long time. And then just adjusting my diet. And then I'm taking some stuff to support my body through balancing the hormones and eliminating all this other stuff. And it actually has been lighter. I've realized, because before I would get super emotional. And now it's much, much milder. And But I mean, I feel like the only way that you can even figure that out is by working with somebody like yourself or the doctor that I was, somebody who's going to test your body as a whole and get to the root to find out what's going on. Because some of these people who are suffering, especially with PCOS or, other things like that, some of them are like, I need the immediate relief. And the birth control is going to potentially give them.
Oh, yeah, like endometriosis.
Oh, yeah.
100%. Yeah.
Right.
I mean, this is something where, there are certainly people that have taken my message and ran with it to be anti-birth control. I am not anti-birth control. I swear I probably have about 120 interviews where I start with, I'm Dr. Jolene Brighten and I am not anti-birth control. And it's something where this doesn't happen anymore because my foot went down and I realized like I needed to have strong boundaries on social media and hold that container, because if women were coming into that space, they were coming in with a vulnerability, wanting to heal. And when women come in and they're like, you're so stupid, why are you taking birth control? Or like, you should just stop that. I'm like, okay, firstly, the only person who can advise that individual on their medication is the person who prescribed it or another prescriber. So if you don't have a license to prescribe these medications, please do not advise on it because you don't know. We know what we know from social media, but what if she has endometriosis? What if this is the only thing right now that makes it so she can function?
Mm-hmm.
There are women with endometriosis who can't function 2 weeks out of the month. Women with PMDD, severe form of PMS, is the best way to describe that. Just wrap your head around it. They can't get out of bed. They can't function. They can't mother. They can't parent. They can't be a partner. They can't go to work. They can't be a boss 2 weeks out of every month. And hormonal birth control does not work for every woman for symptom management. Lots of endo patients, it didn't work. Lots of women with PMDD, it made it worse. PMS made it worse. So it's not a cure-all for, it's passed to us as the pill that fixes every female ill, but it doesn't always necessarily do that. But if it is, we need a plan. And this is what I talk about in my book, is that you want to prep your body a good 3 to 6 months before you come off of birth control. If you're on it for symptom management, for things like endometriosis or issues like menstrual migraines, of course, if you have a migraine with aura, stay away from birth control. That can potentially increase your stroke risk, and we do not want that. There is a time and a place to use these things, and we don't have to judge each other based on our own bias. Yes, but the decisions we make for ourselves. So I appreciate you bringing that up. And in terms of working with a healthcare provider, we all need a healthcare provider. I mean, I explain to people all the time, like, I've got my own doctors. I may be a doctor, but when you're working with your own body, it's a lot like reading a book that's right against your face. You have all the answers. You have them all. It's all there. But it's so close, you can't read it. You need someone who can stand back objectively and read that data for you. And there are women, though, I will say, now that Beyond the Pill has been out for a year, we've got all these babies that are coming, from women who were unable to conceive before, not because they stopped birth control. Oh my God, I just said that. Now women are going to be like, it's because you told them to stop birth control. Firstly, I don't tell anyone what to do with their body because that's just rude. And that's not my place. My son knows, and my husband as well. Like, I hate to be told what to do. Like, it's just like inherent. I think about Gretchen Rubin. I'm more like of the 4 personalities. I'm more of like the upholder. But there are times where I'm the rebel, and it is, if you're like, you will do this, I'm not going to tell you why. You're just going to do it. I'm like, I'm not going to do it.
Right.
It's not going to happen. So in that. But the other things that we've seen with Beyond the Pill is women reversing their PCOS symptoms, keeping them in check. In Beyond the Pill, I prep women for their skin, and I'm like, the skin is the last thing to heal, and it takes a long time. But going through the book, there are women who have sent me pictures of their face, and 2 weeks later, so just supporting their liver, how much clearer their skin is, and I'm like, whoa. There are women who've shown me things I didn't think was possible for someone to be able to do with a book, and they've absolutely done that. And so, I put everything I could potentially put. I mean, we had to cut some stuff out, but everything I could in the book. We also have online programs for women because there are women who their period problems are going to be as simple as dietary and lifestyle shifts. But if you are someone who's like, I'm doing everything right and I'm not getting results, that is your first, like, okay, this isn't me. I'm not broken. I need help. I can't go this alone. And then certainly if you're struggling with mood symptoms at all, there are holistic approaches, but you absolutely need a partner in that.
Yeah, well, I love that you brought up the prepping 3 to 6 months before getting off birth control, because one thing that a lot of people aren't made aware of is how deficient it makes you in vital nutrients. And so a lot of women who are trying to conceive, which is a big group of people I talk to, they're coming off birth control extremely deficient and then trying to conceive when their cycles aren't returning back to normal, especially if they were on it to cover symptoms. And that it takes the average woman 8 months to 2 years to get pregnant after birth control versus 4 months for the average woman not on hormonal birth control. And prepping your body for that 3 to 6 months is huge to start to get those nutrients that you need to start to replenish what birth control has kind of drained from you.
Well, and every woman, so I appreciate you bringing that up, but every woman needs to understand that the egg you become pregnant with goes through a 3-month maturation cycle. So what does that mean? The egg you get pregnant with today was like being matured 3 months ago. So 3 months is the minimum in prepping your body, because as that egg matures, it goes through peaks and troughs of methylation, and it can be really, really vulnerable to environmental toxins and other factors. So we want to make sure that's where, so hormonal birth control depletes folic acid. Wait a minute. Are you talking about that vitamin that we are putting in everything? Because the risk of being deficient in that means baby can have spinal, can basically have spinal issues, brain issues. We can have deformation. So, that's something that I can't believe in 2019 that I still get doctors pressing back on me being like, well, where's your evidence it depletes that? I'm like, okay, so once upon a time in a lab, they actually made a pill with folic acid in it because they recognized this. In addition, every sexually active female in her fertile years should be using a multivitamin or PreNatal, because the reality is it doesn't matter what form of birth control you're using, nature can find a way. It's my little Jeff Goldblum from Jurassic Park. I actually said that the other day. I have said that so many times, waiting for someone to get the joke. I said it. My friend's like, oh my God, Jurassic Park. I'm like, oh, somebody finally got it. No, now I'm just saying. Jeff Goldblum. She finds a way. But in reality, the way we typically use the pill, for example, it's only 91% effective. So 9 out of 100 women are going to get pregnant in a year using that. And if you are one of those women, by the time that pregnancy test is positive, your baby already needed folate. So it's really, really important that you are replenishing these nutrient stores for yourself. You can't out-diet the depletions of medications. And this is something that's really bizarre to me, is when it comes to birth control. So I was taught back in clinical nutrition that birth control causes nutrient deficiencies, therefore make sure she's on a multivitamin prenatal and diet's on point. However, we see it's like birth control lives in its own bubble. There's like this weird thing where it's like, oh no, but not birth control. Go check a drug handbook. Yeah. But when it comes to something like metformin, which in a small percentage of the population, this is a diabetic drug commonly used with PCOS, right now being investigated for potential carcinogens being found in it. That's hot news if anybody's paying attention. And that's, we need better oversight for sure, because that medication does serve a purpose. There's a time and a place. But we're coming to understand, there's alterations in the microbiome that's caused by this as well. And because of this, we can see that a small percentage will become B12 deficient. So when people start metformin, doctors often say, get you on a sublingual B12, fastest way to absorb B12 under the tongue, bypass the gut altogether. With statins are, with the audience we're speaking with, probably no one using statins, but they've probably heard of it because it's used for hyperlipidemia or high cholesterol. And that depletes CoQ10. So if we give statins, we give CoQ10. When it comes to hormonal birth control, there's like this reflex of like, well, no, it doesn't matter. And it really, I think, is born out of this idea that if we question hormonal birth control or we educate women about the potential side effects, they'll choose not to use it. Then we'll have unintended pregnancies. Or, women fought so hard to have access to it, therefore to question it, I don't know, means we're not grateful or means that we could lose access. I 100% believe and will continue to advocate for access as well as education so that women are making an informed decision. I have not come across people that just because I go through all the side effects of birth control, they're like, I'm so scared. You scared my pretty head. I just won't use it. No, I need people to stop treating women like they're dumb. They are not dumb. They're really, really smart. But if you know this, then you can shift your diet. You can also take these nutrients, and getting a good prenatal or multivitamin, it has to be quality, guys, because there's just not oversight. When people are like, well, supplements are not regulated by the FDA. I kind of get, like, as I say this thing about metformin, now I'm kind of giggling. I'm like, is regulated by FDA, carcinogens being found in it? Snap. But the supplement, you need to look for that GMP stamp. That's good manufacturing practices. That means they're holding themselves to the standard of a pharmaceutical, of how a pharmaceutical would be processed. If it is a deal, if you get it at a good price, it's probably not good.
Right.
That's
right.
To make a supplement that is sourced, not just quality sourcing, but ethical sourcing as well, not just depleting the environment, not, there's all kinds of points, that I can go into for that. But you really do need a quality multivitamin or prenatal if you're on hormonal birth control. And this is what I go through in Beyond the Pill, is really like, if we know this to be true, then this is how you stay safe on birth control. These are the tests to talk to your doctor about. Here's when to see your doctor. Here's what you can do personally, because health is the majority of staying healthy is 100% your responsibility, right? Healing happens outside the doctor's office. And so your doctor's really, really important as part of the team, but they can't be with you all the time. So, I've had, there's certainly been some people that they read the book and they're like, well, her attitude, she's obviously anti-birth control. And I kind of crack up. I'm like, guys, I think I'm funny, and you honestly didn't think I was funny, because they're like, people will like, I've had reporters get on the phone and they're like, you said this, and this, and I just start giggling. I'm like, I didn't get to read my book, but if I narrated my book, you would hear it in my voice and you'd probably giggle too, because I was trying to take a really, really serious, dry topic and be funny, but also talk to people like I talk to my patients. Like I talk to my patients like they're partners in this, and not talking to my patients like, I wear the white coat, therefore you do what I say, and like, don't question me. Because I don't know if you've ever had this, but I've had this where I question a doctor on something and they literally roll their eyes at me. And I'm like, and I am just the personality type that I don't get passive aggressive behavior. Like my husband laughs because it goes over. He's like, that person so didn't like you and you weren't getting it. And I don't. So I'll just call it out and I'll be like, are you rolling your eyes at me? Did I say something? I'm like, it's really fun. It's kind of funny because my husband's like non-confrontational and he sees that as really confrontational, but it's more me being like, people all the time are like, oh, you just stick it to them. I'm like, no, I just really didn't understand if that was intended. I was asking a question because I really didn't understand.
I mean, I've had a doctor roll his eyes at me and it wasn't even like the same doctor, I guess, twice, because the first time that I had extreme clotting, it was right when my grandma had passed as well. Yeah. So then I'm like, okay, I feel like my body's just releasing stress this way as well. My hormones are probably super, and I haven't had it like that since. And, I saw him, he was like, well, we can put you on birth control. And I'm like, I'd really like to wait and see what my next few cycles are like, or see, whatever else is going on. And he kind of rolled his eyes at me. And then a year later, I go back for an annual checkup, and it was right before I got married. So I work as a birth doula, and I didn't know a lot of places in the area. I'm newer to this area. And so I was asking him some questions about birthing in their hospital there. And I'm like, well, do you allow women to give birth in different positions? And he rolled his eyes at me and he said, no, you have to be on your back. And I'm like, okay, I won't be giving birth here. And
oh my God. And what is that about? Is that about you? Is that personalized to you? It's about what's convenient for him.
Right.
And I'm someone, okay, so please don't visualize me as I say this. I crawled around on my hands and knees for like 19 hours. I had 19 hours of active labor. And the only way I had to be on my hands and knees in the birth tub, out of the birth tub. I had this beautiful vision. I was like, I'm in a birth tub. My baby's going to come. You know what? You go ahead and make your plans, girl, because it ain't going to go down that way.
Right.
That's why my first book is on postpartum health, because I'm like, that's what I should have planned for. should have planned for my postpartum. I should have had my ideas around birth.
Right.
And like, certainly like I did a home birth but I met with a great OB-GYN at a local hospital. We already knew this is when I'm going to be transferred. So if anything happened, we were going to be transferred. So I even got neonatal resuscitation certified. So I actually I was like, okay, if like anything happens, like, you know, there's going to be a lot of doctors in this room. So I had 2 doctors attending my birth with my friends who were doctors coming in and out. But, you know, in all of that, they tried to get me to push on my back. They tried to get me to push squatting. I got a stool and like I had no power.
Mm-hmm.
So I had no power. I could feel that I had no power. And I had an anterior lip on my cervix.
Mm-hmm.
And I'm a worst case scenario person. Like if you just tell me the worst case scenario and I know how bad it can be, I can handle. I can hang. Like, I'm the person that, like, if you're going to cut me open or you're going to put something in my vein, I have to look. If I know, I'm good. And I was like, what happens if I push past this? And they're like, well, you might tear your uterus and hemorrhage and die. And I'm like, okay, we're not going to do that. Like, we'll just not do that. I was like, I'm just going to push. I don't care. So, but in that, you know, one thing, birth teaches you so much, so much. When people are like, it's a rite of passage, it is a shake you, wake you from the universe kind of experience. And so I was laboring on the toilet, because that's what you do during a home birth. It's actually really comfortable. And I, you know, finally looked at my husband at one point and I just said to him, like, I'm coming out there. I'm going to push. I'm going to be on all fours. And I came out and really owned my power in that moment. And the midwives were like, these are naturopathic midwives, so they're doctors and they're midwives. They were not comfortable. They were like, I've never delivered a baby of a woman on all fours. And I was like, I'm going to push this baby out. You reach in, grab that anterior lip of my cervix, traction it down.
Ooh, ouch.
I will this. Oh, nothing. There's that. It does not hurt when you've been in active labor for 19 hours. Oh, and by the way, I vomited like the entire time. I do birthing right, let me tell you. But you know, I came in, I was really bossy. The whole time I was trying to be zen. So this is like 23.5 hours or something. And I'm like, I'm going to be zen. I'm going to go with the flow. I'm going to follow the pain down. Freaking lotus flower. That's not me. That was like, okay, no. I came out, told them how I was going to do this. I pushed my son out in 10 minutes and I didn't tear. I told them my one thing, I was like, your job's to make sure I don't tear. And they were like, at first they were like, our job's to get the baby out. I'm like, I got that. I'll get the baby out. You just make sure I didn't tear. They did a really good job. Good work to them. But, you know, in that, it was really, I don't think I could have gotten him out any other way. And at the time, so I was teaching group fitness like all through college, and I continued that even while I was pregnant, and I was teaching Pilates. And there's limitations of what you can do when you're 9 months pregnant in Pilates. But I could always do like a cat and cow and use my abs in that way. I still had obliques at 9 months, which was kind of crazy. I say, you know, my sister grew the really cute big bump. It was so cute. I wanted one of those. Isn't it funny one of the things that we think about? But I'm like, you know how like on a Subaru, you have those camper hard shell tops?
Yeah.
That's essentially what I looked like because I have a really long torso. So I didn't get the big bump. But, you know, in that, I couldn't imagine if I had ended up in a hospital and they told me I would be on my back, I probably would have ended up with, you know, in one of the statistics of the unnecessary C-sections. Yes, C-sections can be necessary, but statistics don't lie in the United States. We're abusing those. And I also think there would have been a lot of birth trauma and what is now being termed birth violence against women, which is, you know, no, it's been going on forever. I mean, there used to be a time where they just knocked us out and took babies out of our bodies.
Yeah, it's crazy. I saw a commercial actually the other day talking about how the United States is one of the most dangerous, high-income nations in the world to give birth in. And
of all developed nations.
Right.
Yeah.
And people just really don't realize that, which is why I'm so grateful. So I'm employed at a hospital here now, and I love working with them because they allow women that space. They, you know, and it's so cool to be able to be a part of that because I work with the midwife group here and they are just so like, okay, well, let's try it this way. Are you not comfortable? Okay, what position do you want to be in? And you can just, as long as everybody's healthy and safe, they don't care. and it's just so cool to be a part of that and help these women get to decide how they want to push their baby out, what positions are comfortable for them. They get to be a part of their birthing experience instead of birth happening to them, so.
Well, and let them do what they need to do. Like I cussed a lot, a lot. I was in a lot of pain and it was not pretty. And, during contractions, there were curse words. But my mother-in-law, I don't think she's ever cursed once in her life. Bless her heart. And like my mother-in-law was here the entire time. She was awesome. She had my back. I love her. And there were times that I saw her face, but I've had patients tell me that they've had nurses in the room or providers in the room that are like, I'm not going to help you if you keep cussing.
Oh my gosh.
I personally had that with an IUD. I had a copper IUD placed. And it was really painful. I have patients who get IUDs and they're like, that was a cakewalk. I walked home. It was fine. That was not me. And which was like foreshadowing for birth, I think, for me. But the provider said to me, because I cussed, and she was like, I'm not going to continue to do this if you can't clean up your mouth. And I was like, you right now have a speculum. You're in my body. You have a probe that you're measuring the depth. You guys, you know how they measure the depth of a pond with a stick? You're doing that to my uterus and finding the base. It is incredibly painful. Then she told me, you're not actually having that much pain. I'm like, and this is like, I was getting this placed while I was in medical school. And I was like, I vow never to gaslight a woman, never to tell a woman that I know what her experience is.
Amen.
And that's like, I am super grateful for some of the horrible experiences I've had in medicine because it made me a better doctor. And from the day I opened up my practice, my mantra was always, I do not heal my patients. I teach them how to heal themselves. Like I will give them the roadmap to heal themselves, and I will not own their triumphs and not be like, oh, I did such a good job. This is not about me. The doctor-patient relationship is not about me. It's about her. It's about how I support her and how we work together. So, I think we're starting to see a whole lot change in the birth community as a whole, and hospitals now employing doulas. I think that's amazing, but we still have a long way to go.
Oh yeah.
Because as a developed nation, we shouldn't be, I've had patients who have gone to Canada or who've gone to like the UK. They've gone to other countries to birth their baby because they are afraid of birthing in the United States. And initially I was like, oh, but we've got hospitals, we've got great technology. And then as I started to learn more, I'm like, it's just not where it needs to be, and we can do better. And that's the thing. Again, just like we don't need to hate on ourselves when we mess up, we don't need to hate on the healthcare system right now. We need to look for the opportunities. These problems are invitations for us to do better, and we have the means to do better.
Well, and that's why it's so, so important to be educated, to know your options going in, to know what you can ask for. And I always say this too, if you don't like your health care provider, change. If you're not comfortable with what they're saying, change. That's fine. Like get a different doctor, get somebody who is on board with your plan, get somebody who, I'm sure there's some things that they don't let, but for the most part, I've seen women give birth in hospitals in all different positions, places, whatever, and asked for a lot of crazy things. And you can find somebody out there who's on board with your plan and, who will honor it to the best of their ability. And I think that that's so, so important, because going back to what you're saying with getting your IUD, getting put in, I'm so passionate about when women get dismissed of how they feel. And it carries over into motherhood. When you're dismissed about how you feel about your birthing experience and you're not listened to, you're not heard, you're not made to feel valuable in your own experience, that can carry over into motherhood. You question yourself. You're questioning, oh, am I really in pain? Well, am I a big baby? Can I really give birth? Can I really do this? Am I going to be a good mother? Am I cut out? It just carries over and over. So do not, if you have somebody who is not listening to what you're saying, leave.
Yeah. And it doesn't mean they're a bad person.
No.
It's just not a good fit for you. And as doctors, we don't, or we shouldn't get offended because we have personalities, right? And like, we're not always going to be a great fit. So I've had people come see me and they're like, they've said like, I thought that we were going to be a really good fit, but like, I'm feeling like I need someone who's a little more of a hand holder. So I'm very forthcoming that I'm not the cheerleader, hand holder, the type of personality. I'm a problem solver. I will get in there, solve your problems. So, to knowing this, having this awareness, bring in nutritionists and health coaches who do have those strengths so that my patients are supported in that way. I've also had really candid conversations. I had a patient that was like, I'll never forget her sitting in my office saying like, I just have a really hard time with how much optimism you have and how positive you are. And your energy is just so spunky. And it grates me. And I just straight up said to her, like, it sounds like we're a mismatch. Because if I'm over here doing sunshine, rainbows, and unicorns and loving that, and that's who I am, and that to you is challenging of a personality to deal with, let me refer you. I've got other colleagues who are not chipper. And it's funny that I say that, given that I'm like, I'm not like a cheerleader, but I am literally
right.
but I am really like, I have just seen people be able to do what doctors have said could never be done and then prove them wrong. And I am really optimistic and I'm realistic. I'm definitely realistic when people, I've had women in their 60s who are like, I want to get my period back. And I'm like, I can't do that.
Yeah, I can't. That's gonna happen.
I can't do that. That's not going to happen. But, for the most part, I feel like, when I'm diagnosing PCOS or Hashimoto's, which is autoimmune thyroid disease, one of the top things I diagnose, I don't come in as like, you have a chronic disease. You're going to have a chronic disease for the rest of your life. You're going to be on a medication. And this is the end all be all. I come from a place of like, we finally have an answer. We know what is happening. Like, doesn't that feel good to finally know why and what's happening now? Yes, you have this condition. That means some things are going to shift in your life, but these shifts are actually going to be towards better health. And just because you have this disease does not mean you're debilitated. And in fact, you are not your disease and you can put this into remission. And like, I just come from a place of like, I think so often we get a diagnosis, it becomes our label, it becomes our identity. And I refuse. So I have Hashimoto's. I refuse to be Hashimoto's. My son has a pediatric autoimmune neuropsychiatric disorder triggered by strep. PANDAS. He is 6, going on 7. I refuse to let that child. It came out of his mouth the other day where he's like, well, Mama, I can't because PANDAS. And I was like, no. We are not going to say we can't because of PANDAS. Now, certainly there are times where it's like I can't go out and party all night because I do have Hashimoto's and I know what will happen to me. Like there are those things. There are these things where it's like you have physical limitations that to become your diagnosis and then to let it stop you from living your full life. Like that is like the worst thing that we could be doing to patients. And like, yeah, sometimes we have to have real tough conversations. Like people get cancer, people get Alzheimer's, but like we also have great medical technology. And there's been a lot of evidence to show that if your doctor believes in your ability to heal, you will be more successful. And that doctor-patient relationship is incredibly therapeutic.
Wow, that is so cool. That's so important. Before we end, I do want to touch on prenatal vitamins super quick, only because I had a friend whose doctor prescribed her one that had food dyes in it. And I was questioning it. And she was like, well, my doctor prescribed it, so it has to be good. And I'm like, I don't think so. So what are a few key things to look for in a good prenatal? By the way, I ordered yours and I'm taking it because my husband and I are trying. And I love it so far. But
yeah, I love it too. I take it. I'm not trying to have a baby. But with having Hashimoto's and needing the extra iron, and I monitor my ferritin as well. So let's talk prenatal. Okay, so first thing, yes, check your prenatal. If it has hydrogenated fat in it, no. If it has food dyes in it, no. Food dyes have been shown to have negative impact on our neurological health. Now you are gestating, you are growing a human whose nervous system is very vulnerable. So this is going into, these are the prescription. These are the ones doctors can prescribe. And your doctor may be like, I'd rather know that there's food dye and hydrogenated fats and you're taking this and I know what's in it then you go to a big box store and you end up with something that doesn't actually have what it says it has in it. And it like maybe it has houseplants or other things that aren't even tested. This is crazy, right? Like this can happen. There's been consumer reports showing herbal supplements. They go into a big box store, they test them, they had nothing they said they had in them. That's why doctors are cautious about vitamins. I actually wrote a huge paper on this when I was in undergrad getting my nutrition degree. And that's why, people ask like, what inspired you to start a supplement line? And I'm like, I wanted to know that what I was prescribing patients, what I was taking myself, and what my family was taking was exactly what it said in it. And I knew source, I knew all of this. So, with my supplements, especially with the prenatal, that is one that I'm like, don't mess around. We are growing a human here. This is the future of the human race. So there's not a one. If I won't put it in my mouth, it doesn't go to anyone else. Like that's just our rule in our company. Excuse me. Okay. So let's talk about what to look for in prenatal vitamins. So number one, yes, folate. We want to be looking for folate, methylfolate, not folic acid.
Okay.
Reason for that is that up to 40% of the population has a genetic mutation of an enzyme called MTHFR, and folic acid does you no favors. You can go test that, or you can just swap and go for the folate. Now, folic acid is a very cheap vitamin. Understand that this was developed to put in all the food supply, so it's going to be cheap. Now, I bet you have a nice car, some of you listening, that you wouldn't put the cheapest gas in. You are arguably more valuable than any vehicle ever made on the planet. Don't put cheap fuel in the tank and expect high performance. So that's the first thing. Look for folate. Look for B12. You need to have B12 as well. Low levels of B12 have been associated with miscarriage and infertility, so you want to be mindful of that. B6. So we want to be looking at all these B vitamins, but folate, B12, B6, very, very important ones, along with choline. We want to be looking for vitamin A. Now, excuse me, vitamin A, beta carotene primarily, maybe a little retinol palmitate, but I put this thing on Instagram where I'm like, don't select like a prenatal with retinol palmitate. And some people got confused. So let me take an opportunity here to explain. I'm going to clear my throat one more time.
Yeah. I saw that post and I wrote it down because that's actually what made me order your prenatal, because the one I was taking was retinol palmitate.
And a bit of retinol palmitate is okay. But the problem that was coming through that I was getting a lot of DMs about are women taking multivitamins or taking different supplements that had high amounts of retinol palmitate. And they were being told by, sometimes a multi-level marketing rep, sometimes a health coach, sometimes just a friend. Like, this is okay. This replaces your prenatal. And it doesn't. You can't take a multivitamin and get the same amount. You need different levels of folate, different levels of iron, different levels of calcium. So we really want to make sure that we're looking into prenatals and we want the highest quality ingredients. We want the good manufacturing practice, the GMP stamp on there. And we want to make sure, and this is what I'm really picky about, is iodine and selenium. Iodine, absolutely essential. But knowing that 27 million Americans are walking around, this is the estimate, with thyroid disease, and that half of them don't know it. Hashimoto's being the number one. Hashimoto's unchecked can lead to miscarriage, high-risk pregnancies, so there can be complications. There could also be the cognitive impact, which is to say that if you don't have enough thyroid hormone up until that second trimester when baby's thyroid takes over, that they've done long-term cohort studies and found that up to they went all the way to 16 years of age, that those children were behind. So there's motor skill and cognitive development that's impacted. Yes, you need iodine. If you don't have selenium, then you are risking an autoimmune flare. So you can actually take a high level of iodine in the wake of a selenium deficiency. That can actually cause increase in these antibodies. Increase in the TPO antibodies is associated with increased risk of miscarriage and complications. And in fact, some countries like India, if they screen you and they do a full thyroid panel once you're pregnant along with those antibodies, if they see those antibodies, they start thyroid medication regardless of what the thyroid function panel looks like, because they're so invested in keeping baby safe. And we've seen that there can be some negative impact. So test it before you get pregnant for sure. I give every woman a standing order. As soon as you're pregnant, get to the lab, get that tested, because you may never have had a thyroid issue. You may develop one as soon as you're pregnant. You may have a thyroid issue and you may need a 50% increase in your medication as soon as you become pregnant. And I personally went through this where my thyroid was mismanaged in my first trimester and I had a miscarriage just short of 12 weeks, which is, for women who've never been pregnant, you're trying to get to that 12-week mark. It's like 12 weeks is like when we tell everybody, but also that like this is going to be a viable pregnancy. And so, if you've never been in that position, you're in love at that point. Generally speaking, you're invested. This is your baby. You're in love. So it's a very heartbreaking thing to go through. And so having that personal experience in the work that I do, I always make sure that women are taken care of. And that's why with my prenatal, you'll see iodine and selenium. Selenium, 200 micrograms in the research, has been shown to be able to put TPO antibodies in remission. So that's the other reason why you find that in the prenatal.
So were you saying...
You said real quick, I went as fast as possible.
No, I just have a question. So were you saying that if you are taking iodine without selenium, that it could cause the thyroid?
Yeah.
Okay.
Yeah. So there's studies, Denmark does some of the best studies because of their healthcare system, and they track everybody. And what they did is they tested people's thyroid. They introduced iodized salt, same stuff we're all exposed to here in the US. They introduced iodized salt and found that there was an increased incidence in the diagnosis of Hashimoto's, a rise in the antibodies, and also hypothyroidism developing. Right? Why do we give iodine? So that we're not hypothyroid. Oh, but wait a minute. In some people, it can actually push them in the wrong direction. And this is where, understand if anyone's listening and they're like, oh, but my doctor, understand if your doctor is trained in the United States, odds are they didn't take any nutrition. And if they did, they maybe got a couple hours lecture. And that's something that's really unique about me is I studied nutrition first. So it's really important to understand that if your doctor is commenting on supplements, nutritional supplements, or commenting on your diet, but they don't have, so they're being like, oh, diet doesn't do anything, but they don't actually have an education. They're not actually an expert in it. That's just an opinion. It's not an expert opinion. Well, they are an expert in medicine and whatever you're seeing them for, potentially, they're not an expert in that arena. And I think that's just really important to understand. And that's the part of, being humble in medicine that we need. Is that as doctors, we all need to know when it's time to refer. We all need to know when it's time to stay in our lane and pass this patient. So like you need heart surgery, you got cardiovascular issues going on. It's time for me to refer you to someone else. That's outside my scope. That's not what I do.
Yeah. I want to just ask another question about the thyroid test real quick. So you recommend women in their first trimester going to get a thyroid test. Is it like a specific one? Because I know, so I worked with somebody with my thyroid when I was 26 and we were able to heal it naturally over the course of a couple years. But I know the test I did with her was different than the doctor because the one I took with her like broke down everything. And I know sometimes they just test, is your thyroid working or not, basically.
Yeah, so what they'll test is an indirect marker of thyroid function. This is important for people to understand that TSH, or thyroid stimulating hormone, is a brain hormone that tells your thyroid how to function. When we measure only that, we're measuring only one part of the communication, right? It's like, I think about it's like, if somebody's on the phone and you can only hear one side of the conversation, like what's happening on the other side. So TSH, what the brain says to the thyroid, we want to see how the thyroid responds. By T4 and T3, specifically free hormones, because those are the ones that you actually use and get across the placenta. Now, T4 is for baby. So your doctor might be like, TSH and free T4, and that's it, because baby needs T4. That's what crosses the placenta. But T3 is for you. It's why you poop, why you're warm, why you grow hair, why you get out of bed in the morning. So we want to get that full picture. And then getting the TPO and thyroglobulin antibodies. During pregnancy, we may get thyroid, stimulating immunoglobulins to check for Graves' disease. Graves is hyperthyroidism, much more rare than Hashimoto's, which leads to hypothyroidism. But Graves can come on during pregnancy. And so that's why we may check that as well. There's also a reverse T3 to look at. Most doctors won't order that unless they're specifically trained in thyroid. This is not because they're bad doctors. It's because we as doctors don't order labs that we don't know how to interpret or won't change our recommendations. So if your doctor doesn't know what to do with it, they're not going to order it. It's not because they're bad. And honestly, your reverse T3 should be up when you're pregnant, because reverse T3, it's at least in the first trimester, it slows you down. You gain weight, you hibernate, you slow down. And then also to understand that the beta HCG, which you're measuring, so when you pee on a stick and it says you're pregnant, that hormone is also a weak thyroid stimulator. So we want to look like, is that stimulating the thyroid as well? We can't tell by just a TSH. Like, we want to see those other hormones. So that's what I like to look at. If we have a woman who's hypothyroid, we will start medication. I am always in contact with her midwife or her OB-GYN. And I've never had a situation where they're like, nope, I'm going to take over the thyroid. It's always been, I'm going to manage the pregnancy, you manage the thyroid, and we stay in communication the entire time. And then what I usually do is, if we need a medication, and believe me, if you need a medication, this is not a mess around situation. If you're like, but I want to be one of those people who wears a badge of honor that I take no medications, suck it up and drop it, because their baby's health is on the line. And so if we start a medication, we need to retest in about 2 weeks. Can't test just TSH. They can take TSH a good 4 to 6 weeks to shift, even 8 weeks to really shift and accommodate. We need to measure with taking that medication, where are we at? Because, in the average person, I'm going to say 6 to 8 weeks. In a pregnant person, 2 weeks. Too much is changing in that time. We've got to have it dialed in. We've got to make sure she's taken care of, because, again, this is the future of the human race. It's not just a baby, you guys. This is our future leaders of the human race. Like, I'm very much invested in this, which is why we need to be taking care of all women right now, because they're the caretakers of the future of the human race.
Yes. Oh, amen. I just want to clap out loud. That is so
she
good.
She is clapping. No, they can't see you.
Silent clap. Silent clap. Well, I think that's a perfect place to end this. I mean, I couldn't agree with you more. And that's why just even having you on and just, that's why I'm so passionate about doing this, just letting women be educated and starting to know their options and start to take control and ask for better. We need better.
Yeah.
And that's just it. And it's not going to happen until we demand it, until we, step up and be like, no, we're not going to continue to let women die in the United States giving birth. We're not going to continue to turn people away with symptoms, or tell them that you're not in pain.
Or dismiss women who are having heart attacks or strokes and sending them home to die.
Because the symptoms they show up differently in women than men. So they're like, oh no, you're fine.
That and medical gender bias.
Yeah.
That you're a woman. It must be in your head. You're hysterical. And maybe they're using different terminology now. Maybe they're saying you're anxious. Maybe they say you're high strung. I don't know. It's much of the same thing. It's a throwback to hysteria, being like, it can't possibly be real. It's all manufactured in your mind. And so you have to advocate for yourself. I mean, I was just reading a review on Amazon. I'm telling this right now. I'm fanning myself. I'm like, don't cry. But this woman left a review and she wrote me, and she read Beyond the Pill, and she was actually having a stroke, and she went in with a headache, and she said, if I had not read your book, I would not have pushed back on my doctor. I wouldn't have. She was like, you gave me permission in a way to push back against my doctor, and something that society told me I was not allowed to do. And because of that, she saved her own life, because lo and behold, there was a clot in her brain. Had she gone home, she would have died. I had another woman write me that she had a clot in her lung, and her mom read my book. And her mom was like, this sounds like a pulmonary embolism. You've been on birth control. And the doctor had sent her away, and she went back, and her mom went with her, and they found it. 20 to 25% of people die when they have a clot in their lungs. She is so, so lucky. So while these clots are super rare, statistically speaking, they're rare to have a clot. We can screen for this and do better. I do screen for this in my patients who want to use birth control. But in addition to that, while they are rare, you have to recognize what we're talking about. We're not talking about like you getting acne. Nobody dies of that. We're talking about a clot in your brain, a clot in your lungs, a heart attack, cancer. These things not only impact you and your quality of life and can result in death, they impact your family and your entire community. This is a community issue. Somebody has a stroke, just the financial burden of that alone, of caretaking for them, that is a lot of demand. We are not set up in the United States to support people in this. So what can we do better? we can screen. We can look for factor V Leiden. We can look for MTHFR mutations. I have the whole list in my book. People saying, that's not common. We don't screen for that until there's symptoms. You can't wait for someone to have a clot and then be like, oh, let's screen for that now. No, these are young women who have their entire life ahead of them. And as far as I'm concerned, we need a lot of change on this planet. And a big part of that is getting every single woman stepping into her power. We cannot afford to lose another sister to a medication that's optional because she was never given the full story about it, because her doctor was taught once upon a time that the risk is so minimal. You can say it in passing, but don't really worry about it. And yet there are these stories. There are foundations being started because of women who have died of birth control. There's a family in Canada who they ended up suing the hospital, not because their daughter died, because the hospital denied their daughter twice, but because the hospital refused to change their protocols to ensure another woman did not die. And they're like, my daughter is not going to have died in vain. And what really, you can tell I'm not irritated. I'm like really fired up. What really upsets me is when I see doctors or so-called experts coming up against those parents being like, stop scaring women. It's their right to have access. You shouldn't talk about this. This is all fear-mongering. And it's like, how dare you? Their daughter died. They sent their daughter to college and she started birth control so she couldn't get pregnant. And nobody told, not a one of them, that she could die. Or what about these gals who end up dropping out of college because they get such severe anxiety and depression because they were one of those women, for whatever reason, birth control led to mood symptoms. We're only at a point in research where we can say association. However, for generations, women have said that pill caused these mood issues. And yet we brush it under the rug. We don't talk about it. And we act like women are too stupid and emotion-based. Like, this is seriously what gets me, that we don't share this information. People advocate that we don't share this information because women will get scared. That is so disempowering. That is just saying, you're too emotional. You can't understand this. I cannot with that anymore. Women are not dumb. Women deserve the full story, and they deserve to know what they're getting into. But furthermore, if we don't tell them what the possibilities are, we don't know when to see their doctor. And we do exactly what you said. You said this earlier on. Am I really in pain? Is it really a big deal? Does this really warrant going to the doctor? You guys, I have done this for decades of my life. And even still, I will catch myself being like, this is a little bit off. I wonder if I should go to the doctor. Maybe not. I don't want to oh, wait a minute. The first time you think, I think maybe I should go to the doctor. Yes, you should. Go to the doctor. And I get that it sucks in the United States that we don't have healthcare to cover that. But man, it is much cheaper to eat well, exercise, live this lifestyle, and see your doctor before it's a problem than to come out the other side and have to pay for a chronic disease.
Yeah. Wow. Yeah, that is so good. And I don't get how there's this thing around birth control of not telling people when we are in such an age of informed consent, right? For everything. And it's like, if you want to take birth control, okay, here are the risks. Here is what you're signing up for. Here is, the things that it may benefit or whatever. And it's like, you have to know what you're getting into. You have to know what you're putting in your body.
Yeah. Read the package inserts. I mean, this is something where I have people who reach out and they're like, where are you getting this information? Package insert.
On the pamphlet.
It's in there. You have to read it. Please, please read it, because there was a big, long, hard fight to even get that disclosed. They were trying to keep that away from women as well. There is advocacy groups trying to get black box warnings. There are black box warnings on some forms of birth control because of the cardiovascular risk. It took a lot of women dying to be able to get that. So understanding that there have been a lot of women dying, there have been a lot of women fighting to get us access to this information. And then there are people who are fighting to not allow us access to this information on the basis that this will scare you out of using hormonal birth control. And that is not their place.
No.
That is not their place to decide for you. And that's something that, like, with my patients, we do individualized informed consent. We go through, if you have a family history of depression or you have a personal history of depression, we've got to monitor you tightly if you want to be starting birth control. If you have a family history of heart attacks before age 50, I'm going to run a full lab panel on you before you start hormonal birth control. And I'm going to make sure that we know what's the best choice for you. And we are at that place where we can give this individualized, informed consent. And that's really not what's happening. And I get that, like, this is super inconvenient to hear the issues with birth control. I did it for 10 years. I wrote a book on it, and I cried pretty ugly cries when I was like, oh my God, I had no idea what I was doing to myself. And I prescribed it, and I had no idea that I was prescribing it, and this could happen. So it's something that, like, I've had to move through that as well. And I understand that is very inconvenient to have a doctor come in and say, there are these issues. We need to talk about it. It is not as safe. We cannot say it's as safe as we are currently saying because we don't have the evidence to truly know. There's no long-term study to show us what happens to a woman's body, let alone just her brain, when we put her on birth control from the day she starts menstruating all the way through menopause, and never once did she bathe in her own natural progesterone. Because that progestin is not the same on so many levels. But we don't actually know. We don't know. So when I see experts out there being like, it's so safe, and why would you even question it? And don't even worry about it. And like, you never have to menstruate. Just stay on it forever. I cringe because I'm like, we may very well be on the wrong side of history in making those statements. And this is something that, like, I am very tight about my sleep, and I really guard my sleep, and I've got to be okay at the end of the day with the things that I've said and the things that I've done in order to get sleep at night. And I ain't perfect. There are definitely nights I don't sleep. This is something I think about. If I was out there dismissing women's stories, telling them that it's totally safe, not to worry about it, it's been used like this, there's no evidence to show it's dangerous, therefore don't worry about it, I wouldn't be able to sleep at night. Because how many times in medicine, but women's medicine, have we made these bold, strong statements in the absence of evidence, and then later to find out we were totally wrong? Can we please just use caution as we move forward? Because these are humans' lives. Again, these are the women who will birth, feed, and take care of the future of our human race. So when we think about this in this capacity, like, our entire species is impacted by birth control in very good ways and maybe some not so good ways. And listen, there is no medical intervention out there that is perfect, that is going to be so great. We need to ditch the dogma, and we need to get the muzzle off, because women, like, they need to share their stories. They need to be able to question birth control, and we need to be able to provide them this information. Birth control doesn't have to be bad. You're not a bad person for using birth control. I used it for 10 years. I'm a first-generation college student. I'm very grateful for it. But I really wish someone had given me all the information. And so much of what I put in Beyond the Pill is what I wish someone would have handed me Beyond the Pill the day I started my period. I wish that I would have had it to consult when my doctor was offering me birth control. I wish I had it when I came off of birth control. I wish I had it, and all of this information through my whole life cycle. So that's what I put into it. And I own a lot of health books, and the majority of which I read once and I'm done. I designed Beyond the Pill to be a choose your own adventure and problem solve through your life cycle, so that it isn't just a book that sits there on your shelf. It's something that you get into, and you make sure that you can troubleshoot and get to the doctor when you need to.
Yeah. Man, I'm just like thinking while you're speaking, I'm like, there's so many good quotes from this episode. So thank you so much for coming on. Your book is called Beyond the Pill, and tell people where else they can find you and get in touch with you.
Totally. So my main hub is drbrighten.com, drbrighten.com. There's actually a huge guide on prenatals. There's a huge guide on contraceptives and all the contraceptives available to you that you can go check out there. We put out a lot of really incredible women's health resources. And you can also find me on YouTube, because I know not everybody learns the same. So you can find me on YouTube, and then Instagram is the main place that I like to play on a daily basis. And I'm just at Dr. Jolene Brighten.
Thank you again so much for coming on. I cannot wait for our listeners to hear what you shared with us today.
Thank you.
I just love talking with her. I've been somebody who has struggled with PMS for a very long time and really heavy periods, and I always knew something was off. And the crazy thing is, like, PMS is common, but it's not normal. It's not something that you have to suffer through. And we just have to continue to push for better information from our healthcare providers, because ACOG, the American College of Obstetricians and Gynecologists, has this information on there. And they're the ones who give the information to our providers and says, hey, this is the most current up-to-date information. So why are we not hearing it from our providers? You can go on their website. They have tons of information on there. But yeah, I'm so excited that she came on. She was able to talk to us about PCOS, PMS, finding a good prenatal, everything like that. There's so many options out there. There's so much information, and it's good just to be able to start somewhere and have something under your belt to be able to move forward with. And again, I just want to say, I am not anti-birth control. I am not anti-medicine or anything like that. I think that everyone should be able to have more than one option when going in. There's not a cure-all for anything. Healthcare needs to be individualized. There's no one-size-fits-all for everyone, and we need to have better options, more options when it comes to our health, our bodies, what we're putting in it, and how to recover and heal from the issues that we're facing. If you guys are listening to this and you're not subscribed, make sure that you subscribe, share this episode with somebody who you know would benefit from it, and follow us on our Instagram page, Miraculous Mamas. Follow us on Twitter. Join our Facebook group, Miraculous Mamas by Elizabeth Joy. The women there are just absolutely awesome. And I just want to thank you guys so much for being a part of this with me. We have some amazing episodes coming up really soon. February is going to be a lot of good stuff coming on. You guys, I'm so excited about this year. We have a lot of people lined up to come on that are just going to have so much to offer you guys and our community. So I will talk to you next week. Love you guys.